will go ahead and get started. It is 1 o'clock Eastern Time. Welcome to today's webinar, Finding Environmental Health Information on PubMed. My name is April Wright, and I am an outreach librarian with Region 1 of the Network of the National Library of Medicine, the NNLM. Our guest presenters today, Stacy Mantooth and Kelly Miller, are librarians at the National Institute of Environmental Health Sciences, NIEHS. First, let me tell you a little bit about the NNLM. The NIH, National Institutes of Health, it's the nation's leading medical research agency. The National Library of Medicine, NLM, is one of the 27 institutes and offices of the National Institutes of Health. It is the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM is the network of the National Library of Medicine and is the outreach program of the NLM, working to ensure health professionals and the public have equal access to health information. If you'd like to learn more about us or find your regional medical library, you can check out our website at nnlm.gov. The NNLM is made up of 7 geographic regions, and this is Region 1, which is based at the University of Maryland, Baltimore Health Sciences and Human Services Library, and we serve these states. The NNLM provides funding for health outreach projects, free webinars and classes, and access to a network of public and academic libraries, community and faith-based organizations, and universities. NNLM Discovery is a new podcast launched by NNLM. Podcasts are available wherever you get your podcasts or on nnlm.gov/podcast. Now, please join me in welcoming our guest presenters, Kelly Miller and Stacy Mantooth. Kelly Miller is the Library Fellow at the National Institute of Environmental Health Sciences in Research Triangle Park, North Carolina. Kelly has served as the Library Fellow since October 2021. NIEHS is part of the National Institutes of Health and shares a catalog and a wealth of electronic resources with the main NIH library. The NIEHS library is under contract with Vista Technology Services to provide a full complement of library services and resource management. Before coming to NIEHS, Kelly worked as a library intern at the U.S. Environmental Protection Agency in Research Triangle Park, North Carolina, while pursuing her MS-LS at the University of North Carolina, Chapel Hill. Stacy Mantooth is the Information Services Librarian at the National Institute, NIEHS, also in Research Triangle Park. And Stacy received an MS-LS degree from the University of North Carolina, Chapel Hill. Oh, sorry. Okay, so I'll turn things over to Stacy and Kelly. I'm going to stop sharing. I jumped the gun, sorry. There you have it.
Thank you for that introduction, April. I'm Kelly Miller, and I'm gonna lead off the presentation. So I'm gonna share my screen, and I'm gonna go ahead and stop my video while I'm presenting, just to hopefully keep us from having any technical issues. All right. So today we're gonna talk about finding environmental health information in PubMed. So first, a little bit about the NIEHS. We're one of the 27 institutes that make up the National Institutes of Health, and our focus is on environmental health. We're located in Research Triangle Park, which is the largest research park in the U.S. And this area is called the Research Triangle because of its location relative to the 3 cities of Raleigh, Durham, and Chapel Hill, or more specifically, the 3 major research universities here. North Carolina State, Duke, and UNC Chapel Hill. So today we're going to start, I'm going to give a brief overview of environmental health, including the different types of environmental exposures and some of the major concepts in environmental health. And then I'll talk about what type of environmental health information you can expect to find in PubMed. Then I'll hand it over to Stacy to talk about developing research questions using the PICO framework, selecting relevant mesh terms, and for a demonstration on finding environmental health information in PubMed. So, what is environmental health? Many people might hear the term environmental health and think that means the health of the environment, but it's actually a branch of public health that focuses on how the environment affects human health. It's a very broad umbrella of topics that include things you might typically think of, like air pollution, and also things you may not have considered, like lifestyle or socioeconomic factors. So why is environmental health important? Well, as you can see from this data from the World Health Organization, almost a quarter of global deaths can be attributed to environmental factors. So the environment plays a major role in our health, and so it's critical that we better understand how and why the environment affects us. So this infographic shows the leading causes of death from environmental factors. Most of them are caused by non-communicable diseases like heart disease, diabetes, cancer, and respiratory diseases. And then there are also communicable diseases like malaria, and of course things like COVID-19, which has become a leading cause of death in recent years, though it is not reflected here since this infographic is from 2019. So this is another great infographic from the WHO that gives a nice overview of the different types of environmental exposures, which I'll now go into a little more detail on. So first we have air pollution, which is usually categorized as either outdoor air pollution, things like smog or wildfire smoke or even pollen, and indoor air pollution, such as smoke from stoves and chimneys, dust, pet dander, gases like carbon monoxide. One of the most important concepts related to air pollution is particulate, which is a mixture of solid and liquid droplets in the air that can be inhaled and can contain up to hundreds of different chemicals. As you can see from this graphic from the EPA, particulate matter is very small, small enough to actually get into your lungs or your bloodstream, which is why it's so harmful. Next, we have water pollution, such as from chemical runoff from factories, like the one pictured in the top right. Another example is waste and plastic pollution. For instance, you may have heard of the Great Pacific Garbage Patch, which is a large area of waste in the Pacific Ocean. And that's actually only one of 5 garbage patches in the world's oceans. And then there's also things like toxic algae blooms, as shown in the bottom right picture. And then there's things like lead or other chemicals in drinking water and man-made disasters like oil spills. And then we have soil pollution, which can come from a variety of sources, landfills, agriculture, nuclear power plants, and even from vehicles. These sources can contaminate soil with things like heavy metals, radon, pesticides and herbicides, petroleum products, and radioactive substances. So this graphic here shows some of the important functions of soil, such as carbon sequestration, climate regulation, and flood regulation, and how pollution of the soil has detrimental effects, such as increased greenhouse gas emissions, reduced crop yields, and reduced vegetation, which can actually lead to reduced flood control capacity. There's also food-related pollution, which often stems from air, water, and soil pollution. Not only can food be polluted with harmful levels of chemicals like lead or arsenic or even microplastics, but the nutritional content and quality of food can also be affected by the quality of the soil, water, and air that it's grown in or that it consumes. Antibiotic use in animal agriculture is also a big issue, as overexposure to antibiotics can lead to antibiotic resistance. And of course, there are outbreaks of things like E. coli and salmonella and other foodborne pathogens that cause illness which make an estimated 600 million people ill every year and kills around 420,000 people each year. There's also many pollutants in consumer products, such as endocrine disrupting chemicals like phthalates, which are commonly found in cosmetics, BPA, which is commonly found in plastic and canned goods. You've probably seen BPA-free labels on those items. There's things like flame retardants, which are often used in furniture and electronics, and of course things like phytoestrogens found in soy products. There's also the concept of pollution of the built environment, which refers to anything man-made, from houses, office buildings and schools, to neighborhoods and towns and cities. For example, cities tend to have increased levels of noise and light pollution, as well as traffic emissions. Buildings can become infested with mold or pests, and many building materials contain harmful chemicals like lead, formaldehyde, and asbestos. There's even a phenomenon called sick building syndrome that refers to a situation where someone experiences acute health effects from spending time in a specific building. There's also building-related illness, which refers to a diagnosable illness caused by contaminants in a building, such as Legionnaire's disease, which is caused by the Legionella bacteria that can grow in the water systems in buildings. Another environmental exposure is radiation. All of us are exposed to small amounts of radiation every day, from natural sources like minerals in the ground and cosmic radiation, and from man-made sources like medical X-rays and CT scans. According to the National Council on Radiation Protection and Measurements, the average annual radiation dose per person in the U.S. is 620 millirem. To put that into perspective, it takes a short-term dose of greater than 500,000 millirem to cause a fatality. So this chart here from the EPA shows some of the most common radiation sources and how much radiation they produce. So an environmental exposure that we're all a little too familiar with is zoonotic and vector-borne diseases. Zoonotic diseases include things like COVID, bubonic plague, swine flu, and bird flu. And then there are vectors, like ticks and mosquitoes, that are responsible for almost 1/5 of infectious diseases, such as Lyme disease, malaria, and dengue fever, and cause more than 700,000 deaths per year. Another environmental exposure we're all familiar with is weather and natural disasters, things like heat waves, hurricanes, floods, droughts, and wildfires, as well as more rare phenomena like acid rain and volcanic eruptions. These can all harm human health directly, like heat stroke caused by high temperatures or hypothermia from extreme cold temperatures, and also in a more indirect manner, like worsening air quality from particulate matter and the ash and smoke from a volcanic eruption or a wildfire, which can spread for hundreds or even thousands of miles. So in addition to these physical environmental exposures, there are also social factors that come into play, such as your lifestyle, where you live and work, and your demographics. These are all determinants of your environment and your health. For example, lower income people often experience worse environmental exposures to things like lead paint, noise and air pollution, and extreme temperatures. And they also have more issues with access to things that enable a healthy lifestyle, like healthy, fresh food and safe places to exercise. So some lifestyle factors are things like substance use, diet, exercise, sleep, stress, and even experiences of trauma or violence. Where you live and work are also major determinants of your environmental exposures and health. For example, living in food deserts or areas with poor infrastructure, or living in certain climates or regions that have certain disease vectors or that are prone to certain natural disasters. For example, this map of tick-borne diseases in the U.S. shows how people in New England are more at risk of Lyme disease because the ticks in that region tend to carry the bacteria that causes that disease. Whereas out in the West and the Midwest, people are more at risk of Rocky Mountain spotted fever because the ticks there tend to carry the bacteria for that. Demographic and socioeconomic factors are also major social determinants of health. As this graphic from the WHO shows, low and middle income countries tend to suffer more environment-related health issues, as do small children and adults over 50. Men tend to have more occupational exposures and injuries, whereas women tend to have exposures to things like cooking and gathering water. There's also a lot of data on how race and ethnicity affect one's environmental exposures, which I have an example of on the next slide. So related to those social factors are the concepts of access and disparity. Those different socioeconomic and geographic and lifestyle factors can all contribute to whether someone has access to things like clean water, proper sanitation, or healthcare. And there are disparities not only in who does and does not have access to certain things, but also disparities in terms of things like the level of environmental pollutants people are exposed to. This 2019 study on air pollution perfectly illustrates this. It found that while white people in the U.S. are responsible for much of the consumption driving higher emissions in various industries, Black and Hispanic people are exposed to higher levels of air pollution from those industries, disproportionately bearing the health effects of the air pollution caused by those emissions. So in an effort to recognize, understand, and address these disparities and inequities, the environmental justice movement was born. Environmental justice seeks to ensure fair treatment and meaningful involvement of all people, regardless of things like race and ethnicity, gender, nationality, or income, in regards to environmental laws, regulations, and policies. Environmental justice is a really important concept and has become a major area of focus in environmental health science. Another major concept in environmental health science is genetics and the interaction between your genes and your environment, which can affect your health in unique ways. While most people are familiar with the concept of genetics, you may not be as familiar with epigenetics, which is the study of how your behaviors and your environment can cause changes that affect how your genes work. So while genetic changes are permanent and they alter your actual genes or DNA, epigenetic changes are often reversible and they don't actually alter the structure of your genes, but instead change how your body reads your genes or DNA. So a great example of how environmental exposures can cause epigenetic changes is smoking cigarettes. So in the study cited on the right, researchers found that smokers had less DNA methylation, which is basically a method or a mechanism of epigenetic change at certain parts of a specific gene than non-smokers did. But the study showed those changes are reversible. Smokers who quit can actually end up with similar levels of DNA methylation as non-smokers over time. So of course, climate change deserves its own slide. Climate change is one of the biggest threats to our environment and to our health, with the WHO estimating that we could see approximately 250,000 excess deaths per year because of climate change between 2030 and 2050. And the health effects of climate change could cost $2 to $4 billion per year by 2030. Climate change is a major area of focus in environmental health research. For example, here at the NIEHS, we have our own climate change and health program, as well as being the administrative home of the broader NIH-wide Climate Change and Health Initiative, which spans all the different institutes like the National Cancer Institute and the National Institute for Child Health and Human Development, to name a few. So now that we've covered what environmental health is and seen the different types of exposures and some of the major concepts in environmental health, I thought it'd be interesting to show some examples of topics of actual literature searches that we have done for our researchers here at the NIEHS. We actually all just finished working on a series of searches on climate change and rheumatic diseases, including one on toxicology, one on epigenetics, and one on gene-environment interactions specifically. Of course, we've also done a lot of COVID-related searches over the past few years. And you can also see how some of these searches integrate those social factors, such as socioeconomic factors in the search for racial and ethnic discrimination and hypertension risk in women, lifestyle factors like climate change and sleep or COVID and sleep, and geographic factors like environmental exposures in housing in the Caribbean and South America, or the one on growth stunting and air pollution in Africa. So, what kind of environmental health information can you expect to find in PubMed? As a reminder, PubMed is a scholarly biomedical database, so it's very focused in scope, unlike something like Web of Science or Scopus, which are much bigger multidisciplinary databases. PubMed doesn't really have a lot in the way of gray literature, consumer health resources, books, conference reports, things like that. So if you're needing to find information that's more patient or consumer friendly, you'd probably be better using something like Medline Plus, which is a good resource for that type of information. PubMed is mostly going to have original research studies and review articles, including things like systematic reviews. And PubMed does have filters for different publication and study types, as well as some mesh terms for specific study types or methods, which can be really helpful if you're looking for something specific. And to the right, I've just listed a few of the main study types in environmental health research. Most studies are going to fall into the category of either an epidemiological study or a toxicological study. So this is an example of using the article type filter that I mentioned. You can see that I've checked the comparative study article type, and that the study here at the top is labeled comparative study. So not all studies are going to be fully indexed with study types, but it can still be a really useful tool if you're looking for something specific. And then this is an example of mesh terms for study types and methods, which again are not always going to be indexed for every study. But they can be really helpful if you know that you're looking for a particular type of method or a particular type of study. So I've listed here some of the major environmental health and science journals that are indexed in PubMed. And this is certainly not an exhaustive list, but it shows that there is a lot of environmental health related content in PubMed, including the Journal of Environmental Health Perspectives, which is actually published by the NIEHS. And of course, you can search for a specific journal in PubMed by using the journal field tag, as shown here. So I also wanted to mention PubMed Central, which you can think of as a subset of PubMed that serves as a repository of free full-text articles. While PubMed is a free open citation database, not all the articles in it will be free to access. It'll depend on what journals you have subscriptions to via your institution, or whether journals are open access or not. So if you know that you don't have access to a lot of journals, you can actually filter your search results in PubMed to only show you things available full text for free, such as the things you'll find in PMC. That way you know you'll be able to actually read the studies you found. And the NIH, and therefore us here at the NIHS, as well as a lot of other federal agencies and research organizations, including the EPA and the CDC, actually have policies that mandate that research done or funded by them is made available in PMC. There are sometimes embargo periods, so it may take up to a year after publication before it becomes available in PMC. But the point is that because of these policies, there is a wealth of environmental health-related research in PMC that is freely available for anyone to access. And this is an example of using that free full text filter to only show articles that are freely available like those in PMC. So now I will turn it over to Stacy.
Thank you, Kelly. So if you're coming to PubMed with an information need, often the most efficient way to answer that need is to summarize it into a research question that can be then crafted into a search query. For today, the first example I'm going to use is, does prenatal exposure to di-2-ethyl hexylphthalate, or DEHP, affect birth weight? I started with this question because I wanted an example that was straightforward but still shows you how to search an environmental chemical, since that may be something that many people are not familiar with. Once you have a research question, you may want to move into a framework. The one I'm demonstrating today is PECO, or the PEO framework. A framework usually helps you break down your research question into parts that will help you construct a database query and also help clarify to yourself and others what exactly you're looking for. So the first letter in the framework is P, and that often stands for population, though sometimes you'll see it also as patients or problem. That's who or what the studies you're interested will be conducted in. That can be things like human groups, in vivo, in vitro, or in silico models. The E stands for exposure, and that's going to be the environmental factors of interest, what the population is being exposed to. The C is for comparator. So this is going to be if you have more than one group that you want to compare. Often with environmental health research, that's going to be less exposure versus more exposure, though you also may see something like control groups versus experimental, or sometimes specific amounts of exposures. You may also see where people have dropped the comparator out of the question, since that is often just going to be lower versus higher levels of exposure. The O is for outcome, and that's going to be the effect of interest caused by the exposure. And sometimes you'll also see an additional T added for timing, and that's if there's some sort of time element involved, which may be when sampling occurs, or if there's any follow-up. Or you may see S for study type or setting. If there's a specific study type, they're looking for a specific setting of interest. For our example question, you can see I've already filled in here. Our P is going to be anything that's prenatally exposed. I'm not limiting to a specific model. Our E is our chemical, DEHP. Our comparator is going to be no or lower levels of exposure versus higher level exposure. And our outcome is specifically looking at birth weight. So usually the next thing I do is start to gather search terms, starting with keywords, just natural language words that you're familiar with. You can see I've already added prenatal exposure, prenatally exposed, in utero exposure, fetal exposure, maternal exposure. And you can certainly keep going on with all of these. I've limited it a bit just due to space. For DEHP, I've got several variations of this chemical name. I've also got the abbreviation with phthalate. Sometimes searching abbreviations can be a little tricky because other things are often abbreviated the same way. You can also here add metabolites, for example, of this chemical, what it breaks down to when it's metabolized into the body. You could also add the larger group, so you could just search phthalates by itself if you wanted to as well, if you wanted the whole group of chemicals. Birth weight, you can see several variations there as well. I have included in our presentation several charts with mesh terms that may be useful to you. These link into the mesh database. There are a few that I did want to highlight, so I will go into the mesh database. The first one is going to be this environmental pollution term, and the reason I wanted to point it out specifically is because when I scroll down, you can see there's a very large amount in here that's going to be useful to you when you're doing environmental searches, including specific types of exposures like maternal exposure, dietary exposure, occupational exposures, as well as the various types of pollution as well. I also specifically wanted to point out toxic actions, which is another higher level mesh term, which will have some very useful mesh terms such as air pollution, different types of monoxide, and pesticides. These charts are not intended to be exhaustive. They're just a place for you to start, and many of these will also be in several different character categories. So it's very rare for anything to just belong in one category. They will belong to. So I've gone ahead and filled in our mesh chart for us. So I've added some that might be useful. So prenatal delayed exposure effects is one that's very useful if you're looking at prenatal. Fetus pregnancy. Also, I've included some terms for our chemicals. So I've got the specific chemical as well as the group of chemicals, and you can see several for birth weight as well. I did want to talk a little bit about finding specific chemicals. So again, I'll go into PubMed in our browser. So I've got our chemical here in the PubMed Advanced Search. And I'm going to go ahead and add this to history and show you the search details, because when you search in PubMed, it will automatically try to map to the chemical. So you can see it took the chemical name that we had and switched it to this diethylhexyl phthalate, which is the mesh term for it. But you can see it's also broken the term down into several variations, which is helpful as well. So you really didn't have to do much work for the translation to work there. If you are searching in the mesh database, if you just use the chemical name, it will not find your chemical. What you have to do in the mesh database is delete any dashes, parentheses, or numbers, and put spaces in instead. So once we search this way, you'll see we went ahead and found our mesh term that we were looking for. And if you scroll down, you can see several entry terms that have variations of this chemical name that you can also include as keywords in your search if you want. And you can also see the group of chemicals that's directly above our chemical. The next thing I wanted to talk about is going to be supplementary concepts. So sometimes you'll see instead of mesh after a chemical, you'll see that it's listed as a supplementary concept. So supplementary concepts are whenever new chemicals or new drugs are brought into PubMed, which there's quite a lot of them, instead of being directly added to the index as a mesh term, they're added as a supplementary concept. So these may be changed to mesh terms when the annual update occurs, but so they're available to everyone immediately. They're listed as supplementary concepts first. Supplementary concepts are not part of the mesh hierarchy, so they won't appear in that mesh tree, but they will be mapped to a mesh term within the hierarchy. And automatic term mapping is still going to apply, meaning that if you search that mesh term in PubMed, it'll automatically search all supplementary concepts that are mapped to it. So the example I'm going to use is going to be a metabolite of our chemical DEHP. And as you can see, I put the name into the mesh database again. And again, I'm going to delete out any parentheses, numbers, or dashes. And as you can see, I found my chemical. And you can see as well that it's mapped to our diethyl hexylphthalate as an analog or derivative. And you can see additional names for this chemical as well. If you're ever searching in PubMed and having trouble finding your chemical, you may also want to try PubChem. I'm not going to go into using PubChem because that's a bit out of scope for our presentation. But the PubChem record is going to have a lot more chemical information about your chemical, and you can use that to verify you're looking at the correct chemical. And it'll also have a link to the relevant mesh term. The next thing I wanted to mention is going to be pharmacological actions. So pharmacological actions, there's a large list of them in MESH. The automatic term mapping is going to look for any chemical that's listed as having a pharmacological action in its MESH term. So again, we can go into MESH. And I'm going to look for endocrine disruptors. And I'm going to go to the pharmacological action. So it's automatically going to search these chemicals and any record where the pharmacological action has been applied for chemicals that have that action. And so that's something you can definitely include in your searches. That will be a lot of use. There's a wide variety of environmental chemicals that are included in pharmacological actions. Another thing I wanted to point out that's often very useful is subheadings. So a mesh term can have a subheading that focuses on a particular aspect of that subject. So here I've given the example of diethylhexylphthalate. So if you're specifically looking at when it occurs in blood, you can use the /blood subheading. Or for example, if you're just interested in the adverse effects, that /adverse effects subheadings is just going to find where that chemical has specifically been marked as having adverse effects. I have included the link for the scope notes for different subheadings. And I also wanted to point out that these can be searched independently of a mesh term. So if you wanted to find any record where, for example, toxicity is mentioned, you can do that as well. So here I've given an example of adding together my mesh terms and my keywords. I have added in some TIAB, that's the field tag for title abstract, as well as our proximity operator. So this is going to be prenatal exposure whenever those words are within 2 words of each other, because sometimes people will add in things like prenatal environmental exposure or put some other word into those words, and it's still relevant. We still want to find it. So this is one way we can do that. And as you can see, I've also added this DEHP and phthalate for our chemical search there, and we put and between each of our concepts and or between things that are similar to each other. So putting this all together, when I go into my browser, I can run the search. And as you can see, I've gotten 44 results, and if I look through, most of these are very relevant to what I'm looking for. I would not consider this search a endpoint. I would definitely look through my results, make changes, add additional terms that I found within my search results that I come across to my search, maybe take a few things out. So this is more a starting point for my search than exactly an endpoint. I did also want to speak briefly about approaches for non-chemical searches. So often these are less well defined than searching for specific chemicals. You approach these often the same way you do with the chemical searches, but you're going to do a bit more work in that, defining the question and moving into the framework. So here with our question, does climate change affect sleep, or how does climate change affect sleep? We're going to look at defining the population or outcome to start out with, because that's often going to help us when we think about exposures. So for population, you want to think about special populations or setting. So here we might think about occupational. So that's going to be people with shift work, jet lag. Sometimes you see articles about astronauts, which is of course going to be a very different type of exposure. People in hospitals or care facilities are going to have a very different exposure. People who are unstably housed, infants, pregnant, elderly are often very different from other types of populations. You might think if you want to include people with sleep disorders, so insomnia, sleep apnea, narcolepsy, bruxism. You might also want to think if you're going to include napping or drowsiness. Something from other cultures that might affect your search is if you want to include things like siestas, or for example, sleeping rough is a term used in the UK and Australia for being unstably housed. So if you want to include those results, how is that going to change your search? And as far as other things you might keep in mind is if you want to include articles about circadian rhythm, and those might be in very different models than maybe these other sleep exposures. You also want to think for outcome about what kind of sleep measures you want to include, if you want to do sleep duration, sleep quality, things like that. Once you have a good idea of your population and outcome, then you can start thinking about exposures. So those populations and those outcomes, what are they likely to be exposed to? What do you need to include? So if we think about what's involved in climate change, there is a mesh term specifically for climate change. But if that doesn't get you a lot of results, or if you want to go beyond that, you can also include things like extreme weather and extreme temperatures, ocean changes, growth and pollution, water and food supply changes, UV radiation. So there's a lot of things involved in climate change that you might want to include with mesh terms and keywords that aren't just climate change. You can also think about the possible environmental exposure. So what is the place where people are sleeping? What is that actually like? What's the air quality like? What are the chemical exposures going to be? Are there any physical exposures like light, temperature, humidity, the seasonality, even the smell might change how people sleep? And also the social environment. So are there specific stressors that are affecting people's sleep? Is being unstably housed going to affect their sleep? Resource scarcity, any other thing you can possibly think of. You can add those things into your search. So we're about out of time, I believe. So I'm going to stop there and not go all the way through this search, but we're certainly happy to point you to some additional searching instructions. So NNLM does have training for specific drug and chemical information. What I did today was very brief, so I would recommend if you're interested in that, giving this drug and chemical information class a try, as well as additional PubMed online training. If you're unfamiliar with anything I spoke about today, that would also be helpful to you. So that is the end of our presentation. Does anyone have any questions for us?
One has come through. What would you say is your #1 tip for searching this topic in PubMed?
I don't know if I have a #1 tip. I would definitely always check the search details to make sure you're getting what you're looking for. And also a lot of, I think, searching environmental health comes back to, again, thinking about the exposures in the population and what should be included and what shouldn't be included. Sometimes it's very hard to kind of delineate what you're going to include and what is not going to be included in your search. There can be a lot of slide to what you're looking for, especially if it's not specific environmental exposure or specific chemical that you're looking at. Kelly, did you have anything that you wanted to add?
Yeah, I would say kind of, it's not really a tip, but I think the biggest thing is utilizing the mesh terms, especially depending on your topic. If you're doing something like heavy metals, having that mesh term to use instead of trying to list out and think of every different heavy metal can be really useful. So I would say my biggest tip is utilizing the mesh terms.
Okay, thank you for that. Thank you for your question, Courtney. Beth has a question. With so many variables, are there any tips to cast the biggest net without adding every little term? It sounds like you said a little bit about that now.
Yeah. As I said, mesh terms are really helpful there because they do have that hierarchy. So you can kind of find a broader mesh term instead of having to think of a lot of different things. And also sometimes if you're kind of looking very broadly at things, like if you just want to see environmental exposures and things like that, you can try searching with just words like environmental as a keyword. But oftentimes that's going to give you a sort of unmanageable number of results. So I would say probably just utilizing mesh terms and supplementary concepts is going to be a thing to help you capture a lot of stuff without maybe having to think of every little thing.
And Cecilia has a question. If a topic is fairly new or getting more published, some articles may not have already been indexed. Would you recommend using tags like TIAB instead of mesh terms?
I would recommend, we usually use both, so you can capture those newer articles or things that sometimes, depending on when a mesh term was added, you may also be looking for older material that happened before that mesh term was added. For example, if one was added, this year, even if it's a really great mesh term, it's not going to have very much literature. So in that example, you'd want to include those title abstract, those keyword searches as well. So I would definitely recommend including both unless, you just want like one really on topic article or something.
All right, and there's another question. What are your thoughts on including free text terms and mesh terms? As a general example, if you know that child is a mesh term, would you include child mesh in the free text term child in your search strategy? And you may want to read that question in case.
I would usually include both, but we're also, we want to find as much as we can oftentimes. So it really depends on how comprehensive you want your search to be. Again, if you're just looking for some really good examples of an article on a specific subject, you can just stick with a mesh. If you want to be more comprehensive, you might also want to include child because, again, newer things that are coming into PubMed have not been indexed by Medline yet. So if you don't include the keyword child, you will not be finding those newest articles. So again, it really depends on how comprehensive you want to be and how many results you think you can look through.
Great, thank you for that. So thank you, Kelly and Stacy, so much for your presentation. Oh, okay, Aaron, you wanna add your? And Aaron says, I will add that we always try to have a detailed discussion of the search with the requester. That always helps to find out how narrow or wide to go. Okay. All right, well, thank you very much again, Kelly, Stacy, and Aaron for coming.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.